This vaccine is used to prevent cancer of the anus, abnormal tissue growth of the anus, genital warts, or certain head and neck cancers. In girls and women, it is also used to prevent cancer of the cervix/vagina/vulva and abnormal tissue growth in these areas that can lead to cancer. These conditions are commonly caused by certain types of human papillomavirus, HPV. This vaccine works by increasing the body's natural defense, immunity, against the virus. It does not protect against all types of HPV, only the types in the vaccine. It is used to prevent the diseases and will not treat active anal/cervical/head/neck/vaginal/vulvar cancer, genital warts, or other diseases caused by the types of HPV in the vaccine. Before receiving the human papillomavirus 9-valent vaccine, make sure to read all the information provided by your healthcare professional. This vaccine is administered through a shot into the muscle of the thigh or upper arm by a healthcare professional. It is usually given as 3 separate doses, with the second dose given 2 months after the first, and the third dose given 6 months after the first. For children under 15, it may be given as 2 separate doses, with the second dose given 6 to 12 months after the first. It's important to closely follow the vaccination schedule for the vaccine to be most effective. After receiving the human papillomavirus 9-valent vaccine, you may experience redness, itching, swelling, bruising, and pain at the injection site, as well as fever and headache. Rarely, some people may have symptoms such as fainting, dizziness, vision changes, or ringing in the ears just after receiving the vaccine. Seizure-like movements may also rarely happen. It is important to tell your healthcare professional right away if you experience any of these symptoms. It's important to remember that this medication has been prescribed because your healthcare professional has determined that the benefits outweigh the risks of potential side effects. While a very serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any side effects not listed above, it's important to contact your healthcare professional for medical advice. In the U.S., you may report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967, and in Canada, you may call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before getting the human papillomavirus 9-valent vaccine, tell your healthcare professional if you are allergic to it, yeast, other vaccines, or if you have any other allergies. This vaccine may contain inactive ingredients that can cause allergic reactions or other issues. Discuss with your healthcare professional for more information. Before getting this vaccination, inform your healthcare professional about your medical history, especially if you have immune system disorders, current fever/illness, or if you are pregnant. It's also important to consult your healthcare professional if you are breastfeeding, as it is unknown if this vaccine passes into breast milk. When taking human papillomavirus 9-valent vaccine, interactions with other medications may affect how your drugs work or increase the risk of serious side effects. It's important to keep a record of all the products you use, including prescription, non-prescription, and herbal products, and share this with your healthcare professional. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. This vaccine can be given at the same time as other vaccines, using separate injection sites and separate syringes. It is important to discuss the best timing for receiving this vaccine with your healthcare provider. This vaccine is used to prevent certain diseases caused by human papillomavirus, HPV, in girls and women ages 9 through 45. It is also used to prevent genital warts in girls and women ages 9 through 45. It's important to note that this vaccine may not provide full protection for everyone who gets it. It's also important to continue with regular cervical cancer screenings, as getting the vaccine does not replace the need for these checkups. These screenings should be continued as recommended by your healthcare provider. If you happen to miss a dose of the human papillomavirus 9-valent vaccine, contact your healthcare provider immediately. When storing human papillomav vac 9-val, PF, suspension, it's important to keep it in the refrigerator and protect it from freezing and light. Make sure to store it out of reach of children and pets. When you no longer need the product or it has expired, it's important to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.